Are your parents or grandparents baby boomers? Do you ever worry about how you're going to take care of your parents or take care of yourself as you age? Does Medicare sound like some foreign word to you or something, oh, I don't need to worry about that yet? Well, today's guest is Jimmy Jenkins with Medicare Solutions. Welcome, Jimmy. Thank you
So much for having me. I appreciate it.
He also hosts a Facebook show called The Local Okie.
Yeah.
And Alisha got to be a guest on that recently, so he's kind of a local celebrity.
Pretty exciting.
Yeah, he's really cool dude. So explain to us what Medicare is and why someone needs it and when you need it.
Okay. So Medicare is health insurance for when you retire. So most people, they enroll into Medicare when they turn 65. So that's one of the requirements. You have to be 65 or you have to be disabled in that 25th month or have ALS. But Medicare is a health insurance. It covers 80% of your cost. You are responsible for 20% of that. And so I sell the supplement or Medicare Advantage insurance to cap that 20%. So there's two different approaches that people take when it comes to Medicare. So.
Okay.
Can you explain a little bit how it's different than like going online to Blue Cross and just signing up for a plan for $300 a month or $500 a month or whatever? Or I guess if you have a job, then you would maybe get the Medicare when you're 65. If your job offers your health insurance, you might have that, but then you might get Medicare Advantage to get that last portion of it, or maybe tell me a little bit more.
There's a lot of different scenarios with that. So if you are employed at 65, you do not need to enroll into Medicare because you are what they call qualified through your group insurance plan. So if you're working age 66, 67, you don't need to enroll into Medicare until you actually retire.
Okay.
So that could be age 67, it could be age 68.
Or 90 if you're just 90. Really excited about life, I guess.
Or 90. And so from that point, you would have an 8-month window to where you can enroll into a Medicare. So if you're still working past age 65, in most cases, you do not need to enroll into Medicare.
So would it be a matter of eligibility? If you are working, then you can't enroll?
So if you are working and you have group insurance and it's what they consider credible insurance coverage, then you do not need to enroll because at that point you would be double paying if you enrolled into Medicare plus had your work insurance. But so there's a lot of different scenarios. I am an independent agent. One of the benefits of working with an independent agent is we can shop all the different carriers for you. I know you mentioned Blue Cross Blue Shield. And there's nothing wrong with Blue Cross Blue Shield, but that might not be the best plan for that person
at that time.
Yeah. But you're only going to get whatever Blue Cross Blue Shield offers. And so, if I work with an independent agent, we can shop all the different carriers. We're not tied to any one carrier, and we can truly do the best thing for our clients.
So it's a great solution when you've retired, you need healthcare coverage, you don't want to necessarily go out independently, you want to be able to have a trustworthy source to say, help me find the best option, and that's the solution that you're able to solve for them.
Right. So, for whatever reason, Medicare is super complicated. I don't know why
it just sounds complicated.
Yeah.
I heard it's complicated.
Right. So, there are so many different scenarios involved, and people are losing sleep, they're stressed out,
right, that would be
anxious. People are mad about it, and so, I work in this every day, so to me it's not that complicated, but I do it every day. But for someone that's new to Medicare, I could definitely see how it's complicated because it was complicated to me.
Yeah. And for someone that's in that life change too, retiring, it can be overwhelming to have to figure out Medicare and then find a supplement for the 20% that Medicare doesn't carry.
Right.
I have a question, and really this is probably a great question I know that Alisha has had, y'all talked about last time we were together, was can you get a policy for a family member? Let's say my aging father has Medicare. I want to supplement with another policy to cover the 20%. Can I take out that policy, or does it have to be the person?
Yeah. So in those cases, you could help a family member, an elderly family member, but it does have to be on that individual person. And so in some situations, they might have to qualify medically.
Okay.
And so they would look at, if it was your dad, at his medical history. And so that's going to determine if you can do Medicare supplement or the Medicare Advantage route. And so, the biggest thing with Medicare is, again, it covers you for 80%, and you're responsible for that 20%, but that 20% is uncapped. And so it could be 20% of 1,000, it could be 20% of 1,000,000.
Okay.
And so that part right there is what, could bankrupt someone. If you got
That's
cancer,
the part I was missing. I was like, all right, what does that part do? But there's, I was just thinking cancer patients, you'd be hosed.
Right. So that's where the Medicare supplement comes in to cover that 20%. Medicare Advantage plans, we can cap your maximum out of pocket at $6,700 per year.
Okay.
So there's some pros and cons to each approach,
Sure.
and again, I think working with an independent advisor, they can tell you the pros and cons of each approach, and whatever's going to work best for your situation, that's definitely the route you want to go. But there are some huge differences between the two.
Is there any kind of price range on like what that costs a person each month? I mean, is there a broad price range? I mean, some people are like, I have to pay $3,000 a month for my coverage and stuff. And, is there? I know you can't give exacts on anything, but just like in general. Right.
So when people enroll into Medicare, it's a lot of times a lot less expensive than what they're used to. And so for a 65-year-old, I'll just base everything on a 65-year-old.
Sure.
A 65-year-old lady here in Oklahoma City could get a Medicare supplement for $85 a month.
Wow.
A male could get it for about $95 a month.
Okay.
That's Medicare supplement. If you went to the Medicare Advantage route, they offer plans that are zero premium plans, but then when you go see your primary care physician, you have some out of pocket, some specialist visits you have out of pocket. So that is more pay as you go. To where the supplement, you just pay your monthly premium every month. And
That's great. I mean, if you're on
20%.
disability and you're on a limited income, you know exactly how much it's going to cost, and you don't have to pay anything beyond that.
Right.
I mean, that's.
So it's easy to budget, with Medicare supplement. Again, Medicare Advantage, we can cap your out-of-pocket at $6,700. But again, you might have a hospital bill that's $3,000, and that can really kill someone's budget. So, Medicare supplement's a lot easier to budget, to manage. But there are some people that can't even afford the $85, $95 a month, so then they do have to go
And that's where a family member can help financially pay for that policy.
Right.
Well, that would make me feel more comfortable, if
Yeah.
my parents are in that position and they're retiring and then they get diagnosed with cancer. I'm like, oh my God, how am I going to help them pay for this? They're not working anymore, that kind of thing. That solves that problem. I'd be like, heck yeah, here's my $100. Let's make sure that they get their treatments,
The key thing with that, though, with the Medicare supplement is, so when you turn 65, you have what we call a guarantee issue period. It's a 7-month window. 3 months before the month you turn 65 and 3 months after. So there's a 7-month window to where you can get any policy that you want, no matter what your health conditions. After that 7-month guarantee issue period, you have to qualify medically. So that's why it's very important to make the right decision.
So 65, y'all.
Early on.
65th
3 months before
birthday.
you turn 65.
Yeah.
3 months before and 3 months after. You have 7 months.
You have a 7-month window. That's if you're retiring at 65, but if you retire at 67, then you have an 8-month window.
Around the time that you retire.
Yeah, but you still have that guarantee issue period to where you can get any policy that you want. That's why it's very important to know the pros and cons of each approach. A lot of times
you need an expert to help
Yes.
you through that journey, for sure.
that's gonna tell you the truth, because there can be some conflicts of interest in our industry. It's not disclosed, but I do disclose it. So as an agent, I make almost double selling the Medicare Advantage plan as I do a Medicare supplement plan. So a lot of people will steer people towards the Medicare Advantage plan. In a lot of cases, it's not the best plan.
But you're transparent. I mean, I can tell that from our few times together that, like, hey, this is what's good for you, this is not what's good for you, and here's why.
When I talk to a client, I talk to them as if they're my parents, because my parents would want to know this. I think you should know it, and whatever decision you make is okay, but as long as you know the pros and cons of each approach. So,
What are some of the other services that you're able to offer?
So Medicare does not cover dental, vision, and hearing. So those are some add-ons that we
Okay.
can add as a dental, vision, hearing policy. And then also we can add some cancer policies. There's a lot of different things out there that I could add on, but I just try to stay in my lane and
Yeah.
be really good at those few things. So that's what we focus on.
So we could come to you and say, all right, I have all these problems. Tell me which lane I need to be in, and hopefully you have a solution for that.
If I don't have a solution, I have a good group of guys that I work with
Okay.
that I refer out. So if someone's needing long-term care or financial planning, I can refer that out to experts because there are some people out there that try to be a jack of all trades, and with what we're dealing with, where it's Medicare, insurance, retirement planning, you really need to be an expert.
Absolutely.
And it's just too much to keep up with.
Yeah.
Trying to keep up with all the different products. So I do have a great group of guys that I could refer you out to. It's going to take great care of you. So
That's
Oh, thank you.
really reassuring when you're having to take care of a family member, especially when you're like, I want to make sure that my family's taken care of.
yep.
You're always thinking about your retiring parents. What are they going to do? Did they fall down the stairs? Do they need a life alert? What do they need? How do I know that they're taken care of? So it's great to know that you'd be like, all right,
Yes.
Jimmy, we are going to retire soon and we have these problems. How can we make sure that, Dad is good for the next 25 years?
Right. And like I said, it's always good to call in that guarantee issue period, whatever that's going to be for you. Because again, a lot of times you might not be able to switch to a better plan. You might be stuck on that plan if you've had a heart attack, stroke, or
Right.
cancer. So it's important to
Yeah, that's an important window.
make the right decision, and don't fall for the sales pitch all the time, because that's what you're going to get majority of the time is a sales pitch, and they're just going to tell you the good things with this policy, and they don't tell you the bad things with the policy. So for example, Medicare Advantage, which I would get paid double, they will sell you on it's a zero premium plan, we offer some dental benefits, it's a network based plan.
Okay.
And so what they tell people is, if you go out of network, if it's an emergency, we will cover you for that emergency. Well, what they don't tell them is that that's at the discretion of the insurance company.
To decide if it's an emergency?
Yeah. So really what an emergency is, it's life-threatening, or you're about to risk the loss of a limb. But if I fall and break my hip, to me that's an emergency.
Absolutely.
But they could deny that, and they have denied that. So,
I'm telling you what, kidney stones, that is an emergency. Like that pain makes you feel like you're an emergency.
if I'm the insurance company, that might not be an emergency.
Yeah. I'll come sit on their doorstep and scream then. That's just, oh. But that's
So-
good to know. You need
Yeah.
to know that. Be like, all right, never mind, we're heading to Mercy. No Integris, you're going to have to be suffering another 10 minutes.
Right. Or if you're out of state, a
Right.
lot of people travel, they do that when they retire, and so you might be out of state and can't get back to
Oh, my
Oklahoma.
goodness, that's a really good point.
So you might break an
Yeah.
ankle, break
But that's
a
not
hip.
an emergency.
Well,
It's
it's not-
to the insurance.
It's not considered life or death or loss of limb, so
Right.
they could deny it. Now, if you're inpatient, out of network, they're definitely going to cover inpatient, but breaking the hip, they might tell you,
Yeah.
you got to get back to Oklahoma before we cover you. So,
Okay.
Oh,
Well, those
my
are good
goodness.
details to know. But
yeah.
well, thank you, Jimmy, again for taking time out of your schedule. I know you're a
Thanks for
busy
having me.
guy
This
to
was fun.
come and talk with us on HR Insider, and we'll have Jimmy's information up for if you'd like to contact him or have other questions. But again, thanks for tuning in.
Thank you.